I'm Abraham Morgentaler, and I'm delighted to be speaking to you today to give you a summary of the third annual Androgen Society meeting. I'm going to share my screen here and go through some of these highlights with you. So at the time of the meeting, I was the president. I'm now the immediate past president, and I'd like to go through some of the items here with you. The Androgen Society is a young society that was really designed to bring together all the different specialties, all the medical disciplines that are involved in testosterone-related issues. Urologists, endocrinologists, andrologists. Until today, or until this society, everybody was in their own silos. Urologists, endocrinologists, they didn't talk, they went to different meetings. And the goal was really to bring everybody together into one place and have an annual meeting where we can cross-fertilize, if you will, the different specialties. And it's been a remarkable experience. It's an international society, and membership is open to healthcare professionals. Those of you who are interested, as you watch this, are very welcome to join the Androgen Society. We'd be delighted to have you. And one of the remarkable benefits of membership includes free access to our educational resources specifically. And I think most importantly is we have videos of many of the lectures given by some of the world's experts. It's really just an incredible educational resource, members only benefit. Our next meeting is April 21st to 23rd, 2022 in Orlando, Florida. And we hope to see many of you there. For those of you who are interested in information, the website is www.androgensociety.org. Our annual meeting was held March 12th to 14th of this past year. Due to COVID, it was a virtual meeting. The previous ones have been in person, and we expect the future ones to be in person as well. We had an incredible wealth of information on a just amazingly broad range of topics. What I plan to do with you in this presentation here is to briefly summarize the events and concept raised on day one. In separate videos, I'm going to be summarizing days 2 and 3. And the goal of these summaries is really to stimulate your curiosity, hopefully, give you a little bit of some of the information that was transmitted very briefly, but also to give a sense of the richness of the topic. And again, for those of you who really are interested, join the Androgen Society, and you'll have access to almost all of the lectures that took place at this meeting and previous meetings. I want to mention that we have a new journal called Androgens, Clinical Research and Therapeutics. That's the official journal of the Androgen Society. It was launched in May 2020. Our editor-in-chief is Abdul Traish. I'm honored to be the senior editor. And it's an open access journal, and one of the benefits of open access means everybody can read it. You don't need a subscription, and the evidence of how effective that is that in our short one-year history, we already have more than 19,000 full article downloads. Just astonishing to me. So there we have that. So day one started with the history of testosterone by Professor Nieschlag. Dr. Nieschlag is really one of the fathers of modern testosterone research and clinical practice. He's been instrumental in several of the testosterone formulations that we use coming to market, and also with many of the key concepts. At this meeting, he received the Grand Master of Testosterone Award. This is a slide from his presentation that really was tremendously fascinating about eunuchs and castration and what we learned about them. And here's a slide that dealt with testis transplantation for hypogonadism and aging males. A lot of fun. Um, we had a couple of sessions on the use of testosterone in trans men. Dr. Grober at University of Toronto, together with his colleagues, have created a transgender surgery center. And he described for us the challenges in creating that kind of a center, and as well some details of the surgery that's involved with that. Michael Irwig is an endocrinologist from Beth Israel Deaconess Medical Center in Boston, my home institution, and is an expert on the management of trans men with regard to testosterone therapy. This is a figure from his article published in Lancet Diabetes and Endocrinology. And I think the take-home point here is what this figure demonstrates is just the number of individual organs or tissues that testosterone affects, from psychological, hair, breast, reproductive system, sex, skin, voice, muscle. It's really just astonishing. And in some ways underscores the importance of just testosterone in general for men and in women. But his talk in particular is about management of testosterone, or was about testosterone in trans men. We had a clinical case discussion with a panel where they were given some case details. And just as a flavor, some of the topics that we raised were the use of TTH, which is testosterone therapy, versus PD5 inhibitors in men with erectile dysfunction and low T. And there was no consensus on which comes first or how you manage that, but some interesting perspectives. We discussed the use of free testosterone in clinical practice, how to manage erythrocytosis, and other relevant management issues. I would just comment that, you know, we're in a world of evidence-based medicine. Everybody wants to make decisions based on randomized controlled trials. The truth is there are very few randomized controlled trials for many issues, not just with testosterone, but in general, that have to do with clinical management of patients. A lot of this has to do with the art and science of management, and listening to experts can be extremely helpful for their approaches. You know, when we talk about testosterone, for the most part, groups like ours that meet and discuss the scientific research around testosterone therapy don't address very much androgen deprivation. And yet, I think that that's a critical topic for us, certainly in terms of understanding testosterone and its effects on the human body. We had 3 talks on this general topic. Dr. Crawford discussed why, in fact, we use androgen deprivation in advanced prostate cancer. Dr. Raheem from Tulane discussed its effects on sexuality. And then Dr. Crawford also went through the cardiovascular and metabolic adverse effects of ADT. Dr. Crawford, of course, is the director of Grand Rounds in Urology, for whom we're speaking today. So here's a slide from Dr. Crawford's talk on advanced prostate cancer, and showing here the use of ADT in different situations: local disease, biochemical failure, and advanced disease, and in both hormone-sensitive and hormone-insensitive individuals with prostate cancer, and arguing that there's value in having a testosterone level less than 20 nanograms per deciliter. Dr. Raheem spoke about the sexual effects, which, as most of you will know, obviously reduces sexual desire, libido, and erectile quality, and makes it difficult to have an orgasm as well. In terms of the metabolic and cardiovascular risks of ADT, you know, I think amongst urologists, there's a general understanding of this, But it's interesting that this is one of Dr. Crawford's slides, that the form of ADT seems to matter. And so here we have some different issues: incident coronary heart disease, myocardial infarction, sudden cardiac death, and stroke. This comes from a study by Keating in the Journal of the National Cancer Institute. And here you see no ADT is the reference value. And here we have GnRH agonists, and you see statistically significant increases in all of these cardiovascular issues. Orchiectomy has a pretty high hazard ratio here, 1.4 and 2.1 for myocardial infarction. Combination androgen blockade has a statistically significant here, but not for the others. And anti-androgens appear to not be associated with these same issues. And of course, that's an interesting question as to why that might be a difference. We had talks on the new testosterone formulations, the oral products, which are essentially testosterone undecanoate by Mo Kira from Baylor in Houston. And Adrian Dobbs discussed some of the new injectable options for testosterone. Interestingly, the new oral ones, we have two that are FDA approved. One is on the market already. There's at least one other that's undergoing FDA review. In the past, we thought that oral forms of testosterone were unsafe because of liver toxicity. But the new ones using testosterone undecanoate turn out to be absorbed through the lymphatic system, not through the intestinal vasculature, which goes first to the liver, what we call first pass effect. And this absorption of the newer forms through the lymphatics appear to be quite safe with regard to the liver. And of course, pills are always considered, generally considered the most convenient form of treatment for people. Injectables include a little auto injector that does a sub-Q injection with testosterone enanthate, and with good results on the market, at least in the United States. This is an abstract, I believe this was the prize abstract, on the use of oral testosterone undecanoate for this product Jatenzo. And over 2 years, they showed good testosterone levels. And what you see here is that liver function tests were not affected in a negative way for all of these. So we have a pill, it's available, at least in the United States. It works to raise testosterone, and it's not dangerous for the liver. And at the end of the day, we awarded the Grandmaster of Testosterone Award to Ibo Nieschlag, one of my heroes in the field of testosterone, and certainly well deserved. I think we're going to end that there, and hopefully we'll see you for the summaries of day 2 and day 3.